Hello, guys. Welcome back to the channel. So, today I wanted to do something different. I just want to take you along with me as I go for my night shift, showing you a day in the life, or in this case, a night in the life as an NHS nurse. So, I wake up at 5:20. I snooze to about 5:25 p.m. and then I head down and take my shower after waking up. You can see me doing my skincare now. As a nurse, it's still important to do your skincare, even if you work at night. I'm then taking my all my work essentials, my scissors, my pen, my flashlight, my lip balm, and my hand cream, and then I also take my work badge, which is also my work pass. 2 minutes to spare. Just hope and pray the ward is not busy tonight, but most times it's busy. It's quite heavy at the moment, but we gotta do what we gotta do. So I'll try and show you as much as I can, but of course maintaining confidentiality of my patients and the staff that don't want to be on camera. So I'll try and show you the best that I can. 7 p.m. We start our huddle. So the nurse in charge will discuss all the important care details about the patients. She will discuss, or he will discuss, about poorly patients, tissue viability. That means people with skin, um, any skin issues with the patients, hot topics, and information or important information that we need to know about the patients. And then after that, we have handover for individual patients. So the day staff or the day nurse will give us our handovers, tell us about our patients, how they are doing, the state they're in at the moment, what we need to do, the care we need to give them in the night, and all the doctor's prescriptions that have been prescribed that need to continue in the night. So, what I like to do first thing is to check if there is any outstanding medications or tasks that I need to do or that need my immediate attention. Then thereafter, I like to take my patient's set of vitals. I like to personally do it, so that way I know what my patient's new score is and their state or what exactly I'm dealing with. I then go ahead and take a blood glucose for all my diabetic patients. I also administer insulin if they've got insulin prescribed at bedtime. And also, if any blood glucose levels are high, I will alert the on call doctor because we haven't got any doctor at the ward or any consultant in the ward at that time. So I will contact the on call doctor to come and review the patients. After that, I start to do my med pass or my med rounds. Most of the patients' medications are at their or in their bedside lockers, at least in my trust or in my ward. Most of the patients' medication, oral medication, are in their bedside lockers. So I only take a few essentials that I need, maybe a box of paracetamol, laxatives, and I head out to the bed spaces to give the medications. After my med rounds or my oral medication administration, I then start to do my IV antibiotics as prescribed by the consultant. Um, I've worked as a nurse in Finland before, and while I was working there, we used to mix antibiotics or IV antibiotics with normal saline. But in the UK, at least in the trust that I work in, we use water for injection to mix. Let me know in the comment section what exactly you use to mix antibiotics, IV antibiotics. In the night, we also give CD drugs or controlled drugs, as we call them, such as Oromorph or oxycodone for patients maybe that require pain relief. So we do that with another nurse because those controlled drugs require two signatures from the nurses. So as you can see, I'm priming the line there to remove any air bubbles, as that can be any air bubbles in the line can be very fatal for the patient. We don't want any air bubbles going into the patient's bloodstream. After giving the antibiotics, I like to then I give the IV fluids. So sometimes we have patients that have IV fluids prescribed maybe for dehydration or for electrolyte replacement. So we have different IVIs or IV intravenous fluids depending on the patient's needs, but the common ones that we use are Hartmann's and normal saline. So I'm now preparing the tray to go and cannulate one of my patients because I need to collect some blood samples from them, but they haven't got a cannula, so I need to put in a cannula first. So I'll just take a pink and blue cannula, a blue one for smaller veins, a big one for bigger veins, so I'll assess when I'm at the bedside. So I'm just doing routine bloods. And so how I remember the bottle or the tube colors is by the mnemonic Bad Girls Love Gin. So bad for blue, girls for gold, um, love lavender, and gin gray. But there are other different mnemonics. You can use bleed your patient, which basically can mean bleed for blue, your for yellow, patient purple. And of course, if I'm doing any blood cultures, if we are querying sepsis for a patient, we do blood cultures before the routine bloods. Next, I'm updating my notes. If it has not been documented, it hasn't been done, and that can lead you into trouble. So I document what I've done. I update my fluid balances, my stool charts, water low, and skin maps. I then take my break at around 2 o'clock. Sometimes I do have something to eat, sometimes not. I just wanted to show you our procedure room where we conduct renal biopsies in the renal ward. So it looks something like this. So this is where we conduct all the renal biopsies in the ward, and patients are monitored in this room for 6 hours. So they are usually done on this bed, and they stay in this bed for 6 hours. At 3 a.m., I then do blood glucose readings for my patients that are diabetic. It's important to do that just to make sure that they're not becoming hypoglycemic or hyperglycemic, or in simpler terms, their blood sugar is not going too low or too high. At around 5:30, I start again to do my IV antibiotics, which are usually prescribed to start at 6 a.m. So I'll do my IV antibiotics and any IV medication like for furosemide, or give more fluids for patients that require fluids to keep going. I also do a set of observations or vitals for all my patients, and do blood glucose readings again for all my diabetic patients, and give them morning insulins if they've been prescribed. At 7 a.m., or at least by 7 a.m., most of the time I'm usually done with my work or my tasks. So I'll start my handover to the day nurse, update her about the patients, how they've been throughout the night, what tasks need to be completed immediately, what needs to be reported to the consultants coming to the ward during the day, and what needs their attention. So I've just finished my shift. It was a long night, 12.5 hours gone by so fast. It was quite busy. We had patients that needed a lot of help and a lot of care. But anyway, shift is over. Hope you did like and enjoy the video. Hope it was informative enough for you. And please like and subscribe to the channel. Bye.